An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, board-certified periodontist, Dr. Jeanne Salcetti. Dr. Salcetti, welcome to the program.
Hi, Randy. It's great to be back.
Now, we've had you on the program before, and as always, you look good. You brought some new photos.
I do. I have some wonderful new patients.
And some are very graphic. So we'll save that for last. Probably the most graphic photo we've ever had on the show.
Wow.
So, but there is good news about it.
Great.
So, when dental implants came along, how did that change your life, your career?
Well, my career has always been involved in dental implants. When I did my training as a specialist back in the 80s, we had the opportunity to learn dental implants. And that's what separates me as a dentist, because I have surgical training. I have 3 years of advanced beyond dental school training in the surgical placement of dental implants. And that's what separates us as surgical specialists versus the general dentist. But how it's transformed my practice is that it allows me to be able to take the tooth out, and during that same appointment, that same day, I can put a dental implant immediately into that area.
What about pain? It seems very painful, by the way. Do they complain about it?
Dental implants are not so painful in and of themselves. They go down inside the bone. The bone itself has no nerve endings inside the bone where the dental implant goes. And so, to be honest with you, that's not a complaint that I hear very often at all.
But that keeps people from getting it done.
Well, it's one of the misconceptions.
Oh, really?
It's one of the misconceptions in implant dentistry, is that there's a lot of pain involved and a lot of swelling and a lot of discomfort. And the reality is, you talk to any one of my patients, they just go, oh, why didn't I do this sooner?
Do they really say that?
They really do. Then they tell their friends that the whole concept of dental implants was easier than they thought. It didn't have the pain that they perceived that it was going to have, and they regret that they waited so long to be able to get their teeth fixed or to get that implant put in.
Okay, good. Well, you say you're changing people's lives. Let's take a look at some of these photos.
So this is my very, very dear patient, Barbara. And Barbara presents to me in her early 80s. And she had unfortunately just recently lost her husband. And she had been living with a smile that she really didn't like. She was very uncomfortable.
What's going on there, by the way? I mean, her bottom teeth.
God, Randy, she's got a denture. Well, she's got a denture on the top. That was really her first concern, is because the denture was
looks pretty good, though.
Well, but it looks like a denture. I mean, it's very kind of flat planed. It kept falling out. It was loose. She didn't like the way it didn't support her lip, and she hated her upper denture. When we look at the bottom, you can see that there's a number of things going on. She unfortunately, in dealing with her husband's illness, she never had the opportunity to go seek out dental care. And so if you look at the unfortunate deterioration of her teeth and her gums, you can see that there's been some infection, there's been some decay, and there's been quite a bit of ongoing disease that has been going on in Barbara's mouth.
So those teeth had to go? Couldn't save those teeth?
No, you know what? We were able to save those teeth. What we did is we put it through some periodontal therapy, we cleaned up the gums, we removed the debris off the teeth, and she was able to get every single one of her existing teeth crowned. As well as she was missing some back teeth, and we were able to place some dental implants in the back to be able to give her a full complement of teeth on the bottom against some dental implants that we placed on the top. We placed 6 dental implants with a brand new denture that actually just snaps in and is very, very strong. And she just loves her smile. If you take a look, Randy, look at her smile, look at that face.
Very nice,
I mean, here's a vibrant woman who, is just engaging with, her friends and her family. And when you see this new smile, she just
looks younger.
She does look younger.
She also looks healthier.
You know what? She does. And the thing about the health of the mouth is that we know with the role that periodontal disease can play in overall systemic disease, Barbara puts herself at risk, as any patient
Is that an infection? I mean, is it considered an infection?
It is. It's a very, very, very aggressive infection. It's an infection that those bacteria set up this inflammation that gets into your bloodstream. And I'm sure you've read or you've seen or heard about the association between gum disease and heart disease. It's just very advanced.
So that could be taken care of. And
it can be taken care of.
So a woman like this, just put it off.
Well, they put it off for a variety of reasons. One, possibly dealing with the illness of a loved one. Secondly, fear of going to the dentist, fear of being ashamed that they've let their mouth get to this stage.
Is it true that they don't want to show you their mouth?
Oh, I hear all the time, this is probably the worst that you've ever seen. It isn't
really?
Doc. I'm like, no, this is really pretty good. You know, we can save your teeth, we can improve the health of the gums, we can put a dental implant or two in and get you your smile back. And that is everything to a patient.
Okay, now eating as far as with these dental, very strong.
Oh gosh, very strong. I mean, she loves biting into apples and corn on the cob and be able to chew a good steak and be able to really be.
Do they tell you that? Do they tell you that?
Every day.
Okay.
Every day. It's just wonderful. It's really what creates my passion for what I can give to the patients, because they get to walk out with this gorgeous smile. They're feeling younger, they're feeling more alive, they're feeling like they can go out and enjoy life to its fullest.
So no more dentures. I mean, the future of dentistry, I guess it's happening right now. Denture wearers don't have to be in that situation.
No, denture wearers don't have to deal with loose dentures and feeling that they can't leave their house or go out to a restaurant and go shopping for fear that their denture is going to, you know, be knocked loose if they were to talk or
I
smile.
had a dentist on my show a couple of weeks ago and had me put the glue on my hands. Have you ever had it on your hands? You can't get it off.
Do you know what? I can't even get it off some of these patients' palates when I'm trying to do some surgical procedure. I mean, it takes sandpaper to try to remove.
It really
this
is
adhesive.
interesting, yeah.
And it's thick and it has a bad taste, and patients hate adhesive. So, you know, the first thing to go when you're dealing with dental implants is the adhesives.
So that's good. Okay, so what are we looking at there?
Oh, this wonderful, wonderful
nice.
lady. And with Helen, you can just again see this significant state of deterioration. She came with hating her smile. Her smile looked like she had a picket fence of a variety of different teeth.
Do they get emotional? I mean, do they, in front of you, they say, oh, doctor, I just, you know.
Oh, Randy, they get to the point where they start crying.
Really?
They're
Okay.
crying. They're really visibly upset because, one, they're ashamed that their mouth has gotten to this state of deterioration. Secondly, that they just want to feel better. They want to feel better about themselves, and everyone knows that it starts with a smile. When you meet somebody, it's the smile that, you know, is their first
Well, you're a
impression.
dentist. Of course you think the smile, though.
Well, you know what? I'm an eye person, but that's because I look at teeth every day. But truly, when anybody meets anybody on the street, your first impression of that person is when they talk and when they smile, and to be able to...
Okay, so with her, those two discolored teeth, was that bridge work, or what was going on with her?
Yeah, she just had individual crowns. So she's got natural teeth on the side, and then she's got crowns on the front, and then she's got some bridges in the back. And unfortunately, these were teeth that were not in a state that we could save. And so,
we had to go.
We had to remove those teeth.
So usually the general dentist diagnoses and says, your teeth have to go, then you end up with them.
Right. So the general dentist would refer the patient to me, and I would do a very comprehensive evaluation looking at, can some teeth be saved? Is it best for the patient to lose the remaining of their teeth to be able to come back with a beautiful, new, healthy...
Are there certain people that self-diagnose? My mother, 73 years old, says, I'm too old. And I've told you this before.
You have. And I will tell you, unfortunately, there are many general dentists who say to the patients, you're not a candidate for dental implants.
Really? Okay.
It's unfortunate. And there's a knowledge base and learning that needs to exist to help educate our patients that any patient is a candidate for dental implants. I mean, you have to be healthy. You can't have...
I mean, as long as you're not in the middle of a cancer treatment or things like that.
That's exactly right. And the bottom line is that you have to have bone.
You don't sound like a dentist, by the way. You don't look like a dentist. Do people say that to you?
You know what? I get that a lot. People are shocked that when I come in to meet them that I'm the dentist. They find it hard to believe that I have the experience, that I have the training, that I have the degrees that I do to be able to provide.
You always knew you wanted to be a dentist?
You know, I grew up with a father who was a practicing dentist for 49 years. And so I started out as a chairside dental assistant.
It's like you've always been a dentist.
I've always been in dentistry. It's been, oh my gosh, you know, 30 plus years that I've been involved in dentistry. So I love dentistry.
So you fixed that woman's mouth. What did you do for her?
Well, look at this. I mean, if you look at her after photo, she's got these beautiful...
She makes you want to smile. You
look at the difference in her smile. She's youthful. She loves to smile. She's vibrant. She and her husband travel all over the place. And now she can smile and meet new people with great confidence.
So what does she say? I mean, when it's all done, is this one of those things? I mean, you said it earlier that they said I should have done this years ago.
Well, you know, Helen was one of these individuals where she was transitioning from going from her own teeth to having a denture. So she was very concerned about, what the feel of the denture was going to be like. Would she be able to taste her food? Would she be able to feel the texture of her food? So now we've got this denture that she absolutely loves. It's a beautiful denture. Her
so
teeth
it snaps in, snaps out?
Snaps in, so it's very, very retentive. She's able to clean underneath the denture around the dental implants, and she's able to chew her food and not fear that, you know, it's going to hurt, because she had teeth that there was a lot of pain associated with the infection that she had around that. So now her teeth don't hurt.
So when you remove the teeth, the gums get better.
Well,
and why is that? Why is that?
Because the tooth is an infected tooth is very toxic. It's a toxic tooth that's creating this infection around the gums. So what do the gums do? They melt away. They deteriorate. It's like touching a hot stove. The first reaction is to pull back. Well, the gums in the bone will melt away off the root of the tooth for the exact same reason.
To reject that tooth.
It just rejects it.
Interesting.
It just rejects it. So my next patient is a woman that it just fits the profile of so many women and men that are out there. Here she has a denture. Unfortunately, she
looks like a denture.
Well, it is a denture, and you can readily determine that because the teeth are all flat, and there's not this shimmer and this shine that looks like a natural tooth. And so she's the wife of a very prominent attorney in town, and she was very embarrassed to be able to attend society functions and dinners and to be able to join her husband.
So she tells you this on the consult?
Oh my gosh. Well, she actually was referred to me by a prosthodontist, so she actually saw his Wellness Hour show and said, that's the kind of smile that I want. But she
really okay. I like her already. By the way, she watches my show.
She did.
Right?
She watched your show, and so the prosthodontist referred her to me because she had 2 failed implants up on her upper jaw that were done by a dentist some time ago, and so
I didn't know what he was doing.
Well,
that's what I was reading into. Okay?
I won't go
okay,
there.
you won't go there.
But,
okay, keep going.
But so the dental implants had to be removed. We needed to be able to place more implants, so we had to do some bone work. And we were able to accomplish that. And now look at the difference. She went from what looks like a very classic denture with these, you know, dull type of a smile to teeth that have porcelain. So we've got porcelain teeth
very nice
on her denture. And look at the difference. She's got a youthfulness in her smile. Her teeth look like that of an 18-year-old as opposed to that of a 70-year-old.
So now she's out at these social events.
Oh, she is.
Does she tell you that? I mean,
you know
I keep saying that they tell you
she
that.
really does. She has, you know, a tear in her eye because she
really?
looks at her smile and she feels young, she feels alive. She's joining her husband in all these events, and she is one very happy lady. So one of the other problems that she had with this old denture is that it was very unstable. It was kind of rocking on these very unsupported implants. And so what we have now with the 6 implants that we put on the top jaw is that now she can eat and her denture's not loose, and she's be able to smile and be able to join her friends in a dining experience and not feel really unsure of herself that she's not going to be able to get through the meal without stepping away, like so many denture wearers do. They have to step away from their meal because the denture has been knocked loose.
Is that really the case?
Oh.
So they know. Is there such thing as a happy denture wearer, by the way? Would you say? Like, for example, my father also has dentures, and he says, I'm fine. Do you think he just doesn't know what he's missing?
You know what?
What's your take on that?
Well, I think they accommodate. I mean, the human body accommodates a lot of things. You know, if you are a runner and you hurt your foot, you tend to work around that pain. Well, patients work around ill-fitting dentures.
If there was a try-in period, like a weekend trial for dental implants,
that's right,
they couldn't go back?
You know what? They would never go back to the way that they used to have it. Absolutely.
Really?
You know, because dental implants allow their dentures to be strong, retentive, functional, and it just transforms them.
And you can make them look good. I mean, you work together with prosthodontists to make them look
spectacular.
Okay.
Absolutely spectacular. As well as I work with a number of general dentists who also provide that care of beautiful teeth that are on dental implants. My more comprehensive patients, I work exclusively with prosthodontists.
Okay, now this is getting a little graphic over here. What is this?
Well, this just showcases.
Doesn't look so good to me.
A woman. Well, it just shows that when you want to have a denture that does not have the inside aspect, so it looks like a horseshoe. If I may show you an example of that on this particular slide, you know, you can see that there's a horseshoe without the full denture being present. So you don't have all that plastic up on the roof of the mouth. So it snaps on. It can either snap on to these little gold type cylinders or it can snap on to a bar. And it really just depends on your ability to keep it clean and the decision that the process.
And it's not painful because it looks like something
It's
to be
unbelievable.
afraid of.
You know what? This is so much healthier than having teeth that are infected because there's no infection around the gums.
So the cold sensitivity, all of those things,
cold
hot
sensitivity is
goes away.
gone. Right, that's exactly right. It's wonderful.
So if it's as good as you say it is, and I was on the phone calling you, and I'm listening that it's like 20 million people have dentures. Why aren't they all doing it? If it's this good.
Well, part of it is that denture wearers don't typically go to the dentist. They have their dentures, they seem to fit fine, they're happy, and so they think
So nobody's telling them to do it?
Well, they don't think there's anything better out there. They just, again, as we just said, they get accustomed to that. So what happens is that when they do hear from a friend or they see a friend who has beautiful teeth and they start to question, well, what did you do differently? And all of a sudden the patient says, I got dental implants. I mean, I was able to get implants in my jaw that now I can get teeth that are, you know, kind of snap in and they don't move around on me, and so it allows.
Now the denture crowd, though, aren't they, for the most part, dental phobics? I mean, they don't want to go back to the dentist.
You know,
right?
there's a history with these patients, and the history is that they probably worked very hard at trying to save their teeth. I mean, they probably had some gum disease that, you know, it was sensitive to take care of. They may have had some root canals, and then they failed, and so they started to lose teeth. And as they start to lose teeth, their ultimate thought is that just take them all out. Just take them all out. I don't want to deal with this anymore. Put me in a denture. And so then they're done. I mean, they're done. They've been to the dentist. They've tried their hardest. What they fail to know is that now these dental implants allow them that smile back.
It's interesting to me. So, you know, 4 or 6 implants could give them something that's fixed.
It's great.
That could come in and out or snap in or even permanent. You have
you know what? This next lady, this is fantastic. I mean,
you're excited about this. You like this.
You know, this is my passion. I love to help people. It's not about dental implants. It's not about the practice of periodontics. It's about transforming lives and giving people smiles back that they once had.
Interesting. Okay.
It's great. So this lovely lady, Helen, is again in her early 60s. When you take a look at this before picture and you see her smile, and she's forcing the smile. She doesn't like to smile because she has.
You have to force them to smile?
Well, you have to force them because she's not proud of this. I mean, she's got a very worn denture, classic looking denture.
It does look like a denture.
I mean, look, it's flat teeth. They're all flat. So she hates this. She hates her smile, and so she decided that it was time to do something about it. And so she came to me, actually was referred to me by a general dentist, and what I chose to provide for this patient was the opportunity to go the route of dental implants. She had a complete full denture, and she absolutely just despised it. So I gave her the option of being able to put in 6 dental implants, and you can see the individual implants in this particular photo, but she didn't want to go the route of having a denture back. Now that is certainly a great option for many patients.
That means something removable.
Something removable,
okay.
Right? She wanted the appearance of natural looking teeth. So what we did is we went ahead and created a framework on all 6 implants that is made of zirconium. And so in this next photo, you can see these white looking stubs are where the ultimate porcelain or ceramic crowns are going to be cemented. So while she's got implants as the foundation, if you look at her after, look at that after shot. It is absolutely spectacular.
It's a pretty smile. It's very pretty.
Sexy. It's a very, very sexy smile. She's got this youthfulness. She's got this kind of.
So when you're designing a smile, I mean, what makes up a youthful smile, in your opinion?
Oh, you know, a youthful smile showcases where the teeth are white. I mean, when we're younger, we have whiter teeth. As we get older, our teeth tend to yellow or they get a little gray from the stains of foods or from beverages or from just wear and tear. So what we've done is we've recreated her smile with whiter teeth, teeth that have the appearance of little longer front teeth, and then
it's not perfectly straight across.
It's not perfectly straight across. And so what you see here is the opportunity for this patient to have a smile back when she was in her 20s. And
this is all by design. I mean, the two front, a little longer.
It's very, very, it's done by a ceramist who works, again, with a prosthodontist. They have this in their lab, in their own office, and so they were able to custom make her smile for her and
now that's
try
a good
it
smile.
in.
That is a good smile.
It is absolutely just beautiful, and she is truly a transformed patient. The other phenomenal part of this whole result is that she's able to go out and eat her food. This denture that she had was very loose, it was very ill-fitting, and it created huge problems for her when she was out socially with her friends.
Is this true that the denture wearers may not even really be chewing their food? They're just, I mean, I've been told it's like a cat, like just kind of rubbing it together.
It's true. Well, the problem is that when you lose your teeth, you lose bone. And so you lose bone in both at a vertical dimension and in a horizontal dimension. So all of a sudden, when you had that denture made, you had bone that was present and strong. As you continue to wear the denture pounds on the bone, and the bone starts to melt away, both in a posterior or back dimension as well as a vertical dimension. So all of a sudden, that denture is just slip-slop all around the ridge. It's just has
so, I mean, every denture wearer should go in, get evaluated, see what can be done. At least get something snapping and snapping.
That would be ideal.
Right?
That would be absolutely
Okay.
ideal. You know, it just, what they don't realize is that it will transform how they chew their food, how confident they are when they're with their friends, and they'll just go wide, and I do this years and years ago.
Really? They always say that?
They always say that.
Okay, okay. What else are we looking at?
This is a young woman in her late 30s who had a front tooth that ended up, unfortunately, you talk about the body rejecting the tooth. Well, this particular situation, there was some trauma to that tooth. It couldn't be saved, and so we had to remove her front tooth.
Okay.
How devastating. She's a gorgeous young woman to lose your front tooth. So the one option was to cut down the adjacent teeth and be able to do a bridge. She knew she didn't want to do that. She was a dental hygienist.
Okay.
So she knew that there were alternatives available to her to give her back her front tooth. So that's.
But can you make it look real or authentic?
You take a look at the after shot and tell me if you can tell which one is her natural tooth and which one is the implant tooth.
That looks good.
And the great thing about new technologies that's taken place since the last time that we met is that now they have what is called a zirconium abutment. This is the attachment that goes from the implant, which is under the bone that you can't see, to the final tooth, which is what patients come for.
So when I see that peg,
that
that's
white,
a zirconium.
That's a zirconium.
So you don't get a
abutment.
metal.
You don't get that gray look that sometimes you get with dental implants on crowns. The tooth looks a little off shade, but nowadays with this ceramic that they've got, now you can make it look as natural. You would never know that this was an implant-supported crown.
And we're going to take a quick break. We come back, and I know you brought some very graphic pictures. In fact, if you're squeamish, you don't want to look at this next segment. It is, it's actually what can go wrong. Is that right? In the hands of an inexperienced dentist that's doing dental implants.
That's correct.
Okay, good.
Sad.
And from what I've learned from you, I would go to a periodontist. Right?
That's correct.
That's what I would do.
That's exactly
okay.
right. Right answer.
All right. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about dental implants. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. This next segment, very graphic photos. So if you're squeamish, you don't want to look at this next segment. Okay. So as a recap, we're talking about dental implants.
We are.
A lot could go wrong.
A lot can go wrong. And it's really unfortunate because these are patients who come to me absolutely just dismayed, angry that they have a failed or failing dental implant.
Meaning it's about to fall out.
Meaning, well, as a matter of fact, on this one particular x-ray, and I brought x-rays, and I know that we don't normally...
I don't know how to read x-rays. You know that, right?
Well, I do know that, and I know my patients don't know how to read x-rays.
Okay.
But what I want to show here, the dental implant, which is this white post, it's a screw-looking type post, and how close it is to the adjacent tooth.
So that's not the way it's supposed to look?
No, the implant should be positioned between the two natural teeth, strategically positioned so that it has bone all around it. Okay. And that's what makes an implant successful for the long term. It has to be stable in bone. So if you take the other x-ray, this particular x-ray was again placed by a specialist in dentistry, but not a surgical specialist. And he ended up putting this particular implant in so close to this adjacent
rubbing against the tooth.
It is rubbing up against the tooth.
So that's not good.
Well, it fell out. It completely it became infected, and I had to remove it. The implant just came right out. It just came right out. Okay. There was no bone. And in fact, he had said that when he put it in, there wasn't great bone on the outside. And so herein lies the problem with folks who don't understand the biology and the basics of putting implants in. All right, now here comes the graphic photo.
Okay, this is graphic.
Okay, so Randy, I just want to show that unfortunately in situations where implants are placed, that there could be no bone on the entire outer aspect of this implant. You can see how close it is to the natural tooth. If you look at the x-ray, it's not bumping up next to it, but it is so close that it would be impossible for someone to put a permanent crown. It's too high, and they placed it out too far.
Do you see these problems all the time from inexperienced people?
It's unfortunately becoming...
You came on the show, I mean, when we talked, you said, this is what I want to talk about. I said, let's not go negative. But it's worth mentioning. It's
the reality of when patients are being encouraged to go...
Well, it sounds so easy, by the way. Put in a dental implant, that's it. It works.
You know what? It can be.
But it's not that easy.
It can be. It can be what's called a slam dunk. And slam dunks are great. Everybody loves a patient who's got great bone. But the problem is that, especially in what we call the aesthetic zone, in the front of the mouth, where you better be aware of where the bone is, where the teeth are, and where that implant's going to go. It can greatly alter the end product if you don't know where you're
going. Now, we are just
implant.
about out of time. So right there. This is the way it's supposed to be done.
This is the way it's supposed to be done. These are x-rays to show that an implant can be placed strategically. This is a very, very narrow spot. These are your lower incisors. You know how small and narrow they are. So we've got a small implant that is smack down in between the middle of the two teeth with a beautiful crown. No one has any idea that this patient's got a dental implant.
What you need to know about dental implants today, we're here with Dr. Salcetti, and if they just tuned in, people need to know, of course, and by the way, it doesn't cost more to go to a specialist.
You know what? It's amazing. My fees are actually less than many of the general dentists who are doing this.
Okay.
It's unbelievable.
So you might as well go to a specialist. And we're out of time. But any misconceptions? Anything we haven't talked about? What people need to know about dental implants?
The key that I really want to drive the point home for the folks in Southern Colorado is that they need to ask who is placing their implant, the kind of experience that they have, the kind of training that they have. Is this the 5th implant that this dentist has put in, or is it their 5,000th implant?
Good point.
It's just important to know.
Is there a steep learning curve?
Well, there is, because it's about surgery. It's about the biology of the bone and the soft tissues. It's not about putting a screw in wood, so to speak. It's really about understanding all the foundational tissues that go around, keeping that implant in for a lifetime, and that's what patients want. They want it done one time.
So they're very predictable.
For the last time.
So they're very predictable.
They're great. They're
the
very
success
very
rate
is in the high 90s, 95, 97%.
Okay. So, but with your imaging, with what you have in your practice, if you decide to move forward, I'm putting words in your mouth here, but if you decide to do it, chances are they're not going to have a problem.
I'll know immediately. That's exactly right. And that's why I have this machine in my office, so that I can...
A CT scan, good.
A CT scan in my office, to be able to provide that for the patients on site with immediate diagnosis and give them the opportunity to make a decision about which way they want to go.
You like this? Is this the best part of dentistry? You think the happiest group of patients, dental implant patients?
You know what? This side of my practice is nobody likes to have gum surgery done. That's has to be done, but it's not the fun part. The fun part is transforming, smiles and the ability for patients to get the best out of their dental implants for the long term.
All right. Okay. Dr. Salcetti, always a pleasure having the show. Great stuff. Great photos. Thanks.
Thanks
again.
Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to watch this again or tell a friend to watch it, you can visit our website at wellnesshour.com and just put in dental implants or Dr. Salcetti. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.